Yalimadat, everyone. My name is Dr. Kiran and I'm a psychologist. Thank you so much for being here tonight. I'm very excited to welcome you to our discussion about mental health treatment. We also have a psychiatrist and a primary care provider here with me tonight. We will start off by answering the most commonly asked questions we get in each of our practice, and then we will have some time at the end to answer your questions. But if at any point you do have any personal questions that come up, we ask that you please chat us privately and we can reach you offline. So a little bit about myself, like I mentioned, I'm a psychologist. I currently work at a private practice and I see patients of all ages, but my specialty is really in working with children and adolescents. So now I'll turn it over to Dr. Amin to tell us a little bit more about his role.
Thank you so much, Kiran. Yarim Jamaat, I am Dr. Amin Gilani. I'm a double board certified psychiatrist. I see child and adolescent patients in the outpatient and adult and geriatric patients in the inpatients. So pretty much see all spectrum from 2 to 90 years old people. We normally treat anxiety, depression, bipolar, schizophrenia. ADHD is my specialty. And this is what we do every day, treat mental illness and health. And today we're going to talk to you about any questions you may have regarding mental health treatment. And we are very fortunate to have Asma Baidani with us, who is a primary care provider. Asma.
Thank you, Dr. Amin. So Yagnood, everybody, my name is Asma Baidani. I'm a PA in family medicine. I've been practicing for about 12 to 13 years now with a main focus in primary care and a personal interest in mental health. And so I'm really fortunate to be here tonight with all of you guys. One of the first questions that I get asked really often in practice is, where do I start the conversation? How do I start, the discussion about mental health? And so I often tell patients, you don't have to come in already knowing what's wrong or what you might be feeling. What we ask is just come in and start talking to us about what you're feeling. Some patients might present feeling more tired, feeling lethargic, feeling like they're not having an interest in any of the activities that they used to enjoy. And so more often than not, when you go in to do your annual physical is when your primary care provider or a nurse might ask you some questions about activities that you usually do. Are you enjoying those activities in the past few weeks? And that kind of becomes a screening for tool for us so that we know like, hey, maybe we need to talk about mental health a little bit more with this patient. Sometimes we'll give you an additional questionnaire to kind of answer some questions. This becomes a measurable tool for us to see, hey, do I think that my patient is benefiting from the treatment plan that we came up with? And of course, if you don't feel comfortable answering those questions, we just kind of sit and have a conversation with you to see what might be going on and triggering some of your symptoms. And then, more importantly, if you're feeling any of these symptoms, we encourage you to come in, just make an appointment to come talk to your provider. I do hope most of you can forge a good relationship with your primary care provider to say, hey, I've been feeling kind of down, feeling kind of tired. I don't feel well, so maybe I should go talk to my primary care provider and see why that might be going on. When you think of physical pain and discomfort, like your knee hurts or your head hurts, we encourage you to go see your primary care provider. So I also encourage you to be comfortable talking to your primary care provider about your mental health. And depending on what you and your provider might come up with, they might recommend some treatment, some medications, which we'll talk about in a little bit, or they might recommend that you should see a specialist, like a psychiatrist or a psychologist. So to talk a little bit more about that, I'm going to pass it over to Dr. Amin again to talk about a little bit about the difference between those roles.
Thank you so much, Asma. And I think you brought a really, really important point here is when we talk about the mental health treatment, mental illness treatment, the first stop is to see the primary care doctor, because pretty much everyone, I'm hoping, that has a primary care provider and once in a while sees them. I think I got disconnected. Are you all able to hear me?
Okay. Yes, now we are.
All right.
Yeah.
So I don't know how far you guys heard me. So what I was saying is everybody pretty much has a primary care physicians, and I'm hoping that everyone has a primary care provider. And when we talk about the mental health treatment, I think the first stop is to talk to your primary care doctor about what's going on. You may not need a psychiatrist or psychologist, and oftentimes we get people get confused about what is psychiatrist, what is psychologist. So I'll talk a little bit about that they sounds very similar. Psychologists and psychiatrists, they get I get confused with the psychologists a lot of the time. Sometimes I get upset, but they're also very important. Now, they they both are experts. So psychologists and psychiatrists, they both are expert into treating and diagnosing mental illness. However, their education background, their training, and their role in treatment is very different. So, psychiatrist is somebody who is a medical doctor who goes to the medical school for 5 to 7 years. Then they decide to do a specialization in mental health, just like cardiology, neurology, orthopedics. So, they decide to do mental health as a specialty. So, they go for a residency for about 3 to 4 years. And then some decides to do a super specialization into addiction, or like I did for 2 years in child and adolescent psychiatry. So we get about 15 to 16 years of education just to kind of be a psychiatrist and treat mental illness. And psychiatrists mainly treat patients with medications. Now, in the past, we used to do a lot of therapy, but because of the need, there is not enough psychiatrists to treat everyone with the medication. So that role has been uh, given to other facility. Now, psychologists are master in mental health. Most often, they will be PhD or doctorate in mental health. We do have Kiran, who is PhD in psychology, and she'll tell us about what psychologists do and what happens in therapy.
Thank you, Dr. Amin. So like I mentioned earlier, I'm a psychologist, and my primary work is with children and adolescents. So one of the most commonly asked questions I get is, what does mental health treatment look like, right? And so I like to put it in, a few different forms, but the most common one include psychotherapy, medications, and then psychological testing. My focus tonight will be a little bit more on the therapy and the psychological testing, and Dr. Amin and Asma will talk a little bit more about the medication side. But starting with psychotherapy, that can be provided by, mental health counselors, therapists, and then psychologists like myself. So we have a couple different people who can, provide the therapy. And then medications is primarily prescribed by primary care providers, like we have Asma here, nurse practitioners, or psychiatrists like Dr. Amin. And then the third form of mental health treatment is psychological testing, which is only conducted by psychologists like myself. So that's just a brief overview of how the three of us work together to kind of make up that mental health treatment team. So one of the questions in my question that I get asked is, why do people seek treatment? People seek treatment for themselves and their children across the lifespan. So there's not really, one moment where, it's like the magic time to go to therapy. And really people turn to therapy when they feel like they can't feel better themselves, or it just feels like, something is off and I want to talk to someone. Some of the most common reasons, people might go to therapy is, they're feeling sadder than usual. They might be having a lot of worries. They might be feeling anxious. With that, we see a lot of sleep issues. Sometimes we see issues with appetite, motivation. They might feel like they don't want to do anything, or really a tough transition. So we can talk about, personal and financial crisis. Maybe there's been a death in the family and they're just having a hard time coping. relationship conflict, and then the one that we've all kind of been through is the pandemic. So I think one of the most important things about therapy to point out is that maybe there's a myth that people only go to therapy when there's a big issue. And I really want to get that across today that, you know, therapy is for anyone at any time, right? Like I said, it doesn't have to be a big issue. It just can be that I want to talk to someone. And I'm a little biased, but that's why therapy is awesome, because, you know, you can learn about yourself and it doesn't have to be something drastic. So yeah, I feel like therapy is really for everyone.
Fantastic. Well, thank you for sharing that perspective. And I think, and when it comes to this, it's so important to talk, especially because you do see children and adolescents a lot, both you and Dr. Amin. I'm sure often parents and patients are always asking me too, like, will this be on my permanent record? You know, are you guys going to talk about me when I'm not there? And I think that that's really important to talk about too, because some of the things that keep people from seeking help or going to therapy is the fear of others knowing, right? And it's so important, I think, that we emphasize tonight that we value your privacy and what you trust us with to the highest level. You know, unless I am worried about a patient's safety, there's no reason for me to disclose anything we talk about. Especially in primary care, I see a lot of families. So I'll see, you know, parents, and then I'll see their kids, and then I'll see grandparents. I'll see mother and daughter-in-laws, and then, you know, they'll come in and kind of talk to me about each other, and it stays in that room. And I think that's so important to understand, whether it's a professional setting in which, you know, obviously we respect that privacy, or in the service sector. So if a Jamaati member comes to me, whether it be on a personal note because they know I'm a primary care, or through health board or whatever, or social welfare board, whatever capacity might be, if I refer them to somebody, let's say I say, hey, I think Dr. Amin would be a great resource. That's where the buck stops. I don't call up Dr. Amin on a random Saturday and say, hey, so how's that guy doing? You know, we completely respect that privacy, both professionally and in our service sector. You know, as a primary care, we definitely don't talk about any of your information. You know, I don't even tell like your family that I've referred you, or you came in complaining about depression or whatever it might be. In fact, I had a case today where I see this gentleman and his entire family comes to me and he's like, you know, I think my son came to you for depression last week. And I was just like, I'm not going to answer that, you know, because I'm not going to cross that barrier. And then similarly, a lot of patients, I'm sure, worry like, what will my family think? Or will my family find out that I'm in counseling? And quite honestly, I just tell patients, I'm like, they'll only know what you tell them. You know, if you feel comfortable disclosing that or sharing that, then that's great. And if you don't, it's not my place to make you have that conversation with somebody you're not ready to have that conversation with. And similarly, I wouldn't disclose it even if they're, you know, and you guys can kind of talk about how you might handle a minor situation, but I'll never disclose the reason for their visit. And I'm sure you guys wouldn't, and nor do we like stand around by the bar after Kana and talk about patients, you know? And so, you know, I think it's important to understand so many people struggle with mental health. So many people have depression and anxiety. And, you know, you fear that if it's going to be on my permanent record, I don't want to seek help. And that's definitely not a good reason to avoid treatment and seeking help, you know? And I know Dr. Amin's going to kind of talk about that too, but you know, you're not really going to go into a job interview and someone's going to say, tell me about your mental health. Do you see a psychiatrist or a psychologist, right? And then if you feel like it'll impact your job, that's a discussion for you to have. That's not something that I'm going to disclose, right? So Dr. Amin, if you want to kind of touch base on that too, I think that's so important for our Jamaat to understand that.
Right. And I think you brought such an important point, and especially in our Jamaat, in our culture, mental health has been a stigma for a very, very long time. Like, I think if 10 years, 20 years ago, I mean, to the date in India and in Pakistan, I'm sure in other part of the country too, it's called mental doctor, mental health. I mean, mental doctor. Like even psychiatrists used to be called mental doctor because it's like the only thing we associate mental health is being a pagal.
Mm-hmm.
And that's a theme. But I think nowadays for last 5 years, 10 years, I think Jamaat has really got to the point like they understand and they have seen how common this is. uh, if you look at how common mental health is like 1 in 5 people are struggling with mental health. So we know there may be one in our family, one in our circle, like there's every single person here knows someone who has been struggling with mental health. So I think we are crossing that bridge now where we have accepted that mental health is here and we need to do something about it. But when it comes to the treatment, people still hesitate a lot because they feel like, what if somebody find out? What if they know about my diagnosis? I often make about this joke is like if somebody gets the heart attack, everybody is like proud. Oh, I got bypass, I got three strand, I got cabbage. But when it comes to depression, we all kind of whisper and say, shh, right? Because we still haven't accepted that. And the biggest reason is people think that their information will be shared with others. Now, HIPAA is a very, very strong thing that medical field faces. Like we cannot share anyone's information. I cannot share it with my wife. I cannot share it with anybody. Um, Now, when you decide or you are thinking about seeing a psychiatrist, that is a big step. Not many people take that step. And I think the goal of this webinar today is to help you feel comfortable seeking mental health treatment. It should not feel, oh my God, this is such a big deal. Once I go and see a psychiatrist, they're going to put me on medication. If I go, I'm going to be locked into the life getting a treatment. I'm going to get addicted. I think there are a lot of fears seeking mental health treatment. And I think that's what we are trying to answer today. Now, when you decide to come and see a psychiatrist, first is going to be uh, people may feel that they've taken a big step. And after making appointment to going and seeing a psychiatrist, which is for me, it may be very easy because this is what I do every day, but it may be hard for you to make an appointment for your wife or your child. Um, Sometimes I see a 2-year-old, 3-year-old coming for a diagnosis of autism or ADHD. It's not easy decision for parents to come to a psychiatrist. What you need to know is what happens in the first psychiatric appointment. I think that would help you ease some of the anxiety. So what happens when you decide to come to see a psychiatrist? First, you may have to do a lot of paperwork. That includes that your information will be protected by us. We will not release that information to anybody unless you put your family member's name in it. Otherwise, we will not share the information. Sometimes we may ask to fill the scales that will help us objectively diagnose it. Once you come and see, first appointment is usually 40 to 60 minutes, and we will just ask questions. What's going on? How long it's been going on? How did it started? What makes it better? What makes it worse? Have you ever had anything like that in the past? Have you ever had any other psychiatric illness in the past? Anybody in your family have a history of any depression, anxiety? So I think it's a good idea to come prepared with those information. A psychiatrist normally asks about if you have any medical problem because a lot of the times medical condition can cause you, like if you have anemia or if you have hypothyroidism, that can make you tired, not wanting to do anything, and that can present just like depression. Sometimes mental illness can worsen your medical conditions, like if you have acidity, or so your anxiety can worsen your asthma or your GERD. So it's important for a psychiatrist to know about your medical condition. Also, they may ask you about what medications do you take, because sometimes some medications will make your mental illness worsen. Like if you're on steroids, sometimes that can cause you to have mood swings. If you're on hormonal pills, that can cause it. So every question that psychiatrists ask you has a meaning to it. Now, psychiatrists will also and have to ask you some difficult questions is Do you have thoughts of hurting yourself? Do you have thoughts of hurting other people? Have you been hearing things or seeing things? These are very standard questions and they have to ask you. Now, when psychiatrists are asking you these questions, it's very common for us to see patients getting or person getting a lot of emotions. They cry, they get angry, they get upset, they get very nervous. These are all common emotions that people experience, and it's absolutely okay for you to feel it. Now, towards the end of the appointment, the goal of the appointment is to understand what is going on and create a plan for the future. Sometimes it's easy to diagnose in first visit, oh, you have anxiety or you have depression. Sometimes it's easy to say, you know what, you're just worried for nothing. You may have nothing or you don't need treatment. Sometimes we may say that, hey, you may have some mild to moderate anxiety and depression. You may need therapy, or if you have a serious where you're having thoughts of hurting yourself, or you're getting suspended from the school, or if you have a serious conditions where it is interfering with your functioning, that is only when we suggest and recommend treatment. I want to repeat this. Psychiatrists can only recommend, they cannot force you to take the medications. So just because you're going and seeing a psychiatrist doesn't mean you are going to get prescribed medications. You can always tell a psychiatrist that, hey, I want to think about it, I want to research about it, I'm going to ask questions to Dr. Google and then get more scared. I'm just kidding. But it is important to understand what the process looks like. So that is what happens in your first psychiatric appointment. And then if we decide that, hey, you need the therapy, then we refer it to a psychologist. And Dr. Kiran, tell us what happens when they come for your appointment.
Absolutely. Thank you. So I'm going to talk a little bit about therapy and what to expect when you first start treatment. So as many of you all probably know, psychotherapy typically involves talking, right? But that's not the only part. And yes, we do talk, but it's actually a lot of hard work, and that's why it works, right? So really the goal is to help individuals by giving them insights into challenges and teaching them coping skills, right? And the way I start with that is, like Dr. Amin said, I will do an initial evaluation with my patients. We'll talk about background information. We'll gather sort of what's going on. And then we create a treatment plan. And I put a lot of emphasis on treatment plan because I sit with my patients and we come up with goals together, right? And that doesn't only help me focus treatment, it also helps my patients feel like they're making progress, right? What better way to track progress than goals? So that's what we come up with. And I think, again, something to highlight here is that we do the goals together. I never tell my patients, like, this is what you need to work on, because therapy is what you put into it, right? Of course, I'll bring my expertise, but ultimately I do want to create a safe space. And that starts with my patients, and they know themselves. So that's what I want to sort of bring out. And before I mention, coping strategies, so I think every provider is going to be a little bit different, but personally, I put a lot of emphasis on skills, right? So when I talk about skills, what do I mean? I'm talking whether it's communication skills, I want to learn how to communicate better with my family, with my spouse, with my partner, right? I'm having really big emotions. I don't know how to handle them. We have skills for that. I want to be more present. I feel like I have a lot of thoughts and I can't focus. We have skills for that. And we would teach, mindfulness techniques. So there's a lot that happens in therapy besides just talking, right? And as I mentioned earlier, the most important part of therapy is creating a safe space. And that's my job, to help you feel, comfortable, feel like you can really share what's going on. And both Asma and Dr. Amin have mentioned this, that comes with confidentiality, right? So I think, Asma mentioned that what happens when she sees different family members. So I personally have a few patients that are, siblings, or I often see teenagers, right? And I'll have parents ask me like, hey, what did you talk about? And I tell them from the beginning that that's just my style. Like, I will check in with you, once a month or periodically. But please know that I'm never going to give you details, right? How can I expect my teenagers to give me very, important details if they think that I'm going to tell their parents, right? So that's a really big expectation for parents that I have to set sort of right away. Now, I know that that might feel kind of anxiety provoking as a parent. So what do we do with that? So I kind of reassure my parents that, look, if it's ever a safety concern, of course I would tell you, right? But knowing that I care about them just as much as they do, right? And we're a team. I want to work with my parents, not against them. And at the same time, I do have to make sure that I'm keeping that information confidential so the teenager feels like they can open up to me. But that's just one of the examples that I, thought of that I come across a lot. And then, as I mentioned, again, every psychologist approach will be different, but most of my patients start to notice changes pretty early on, especially if, they're doing their homework and they're using the skills. I can give all the skills, but ultimately I want my patients to practice them throughout the week, and then we meet again and we talk about that, right? So that's where the work happens. So it's not just talking. And really a lot of the treatment, again, it's going to vary depending on the severity. If I have a high risk patient, like Dr. Amin was talking about, right? If I have suicidal patients, their treatment is going to look a little bit different, and the duration will be different too. But typically, therapy lasts anything from 4 to 12 sessions. And as I make the treatment plan with my patients, I always kind of recommend, do we want to start with weekly therapy? Do we want to start with biweekly? And again, I do that depending on their needs, and it's going to look a little bit different for each of my patients. And then lastly, medication is a big part of treatment at times. If I feel like, a combination of therapy and medication will be most appropriate for my patient, I will oftentimes refer them to either the psychiatrist or the primary care provider with consent, right? So I want to point out that we're talking about confidentiality, but even when we talk between for example, if the three of us are a team, right, we still have consent forms that we're all signing, the patients are signing, right? So I'm never going to just call up Dr. Amin or Asma and say, hey, I'm sending my patient there, right? Unless I have their consent. So we really want to, emphasize that, because it is one of the biggest concerns that a lot of people have, especially when we're, seeking treatment from a smiley providers. That's a concern. So I really wanted to emphasize that we do take confidentiality very seriously, not just for ethics, but also because we want to make our patients feel safe.
Thanks. I noticed you mentioned a couple of times that it's not just talking. So I like that, like emphasizing that you do more. So, one of the important things, like even in primary care, is, when a patient comes in, you often have to think about what are the treatment options I'm going to be offered. And like both of you guys mentioned, it's a partnership. It's not a decision that in primary care, I'm going to put them on something. Patients will express concerns about weight gain or feeling tired or not being able to wake up the next morning for work. Those are important things to take into consideration when patients are talking about what are my treatment options. Oftentimes, patients will even say to me, like, I've trusted you, I'm not ready to go to a counselor yet. And so in primary care, you end up playing this, strange kind of a role where you're trying to convince them, like, by far, I am not trained to do what Dr. Kiran does. So you need to go see Dr. Kiran and do this counseling properly. But until we can gain that trust, I would never force somebody to go or send that referral without their consent, like you mentioned. And often when I'm seeing patients, like you guys mentioned too, the first visit that it comes up, it might be in your primary care, in your physical exam. And that just doesn't allow, unfortunately, the way we're structured now, a lot of time for us to sit there and kind of talk about mental health with our patients in primary care. And so sometimes I'll have patients get upset because they'll say, you're wanting me to come back, but I'm here today. I want to address this now. And I do want to take this opportunity to mention why it's so important that we don't rush that conversation, right? To kind of make this a partnership, it needs to be the patient trusting us, and then we're having a conversation and a dialogue to say, is it time to go to a psychiatrist? Is it time to go to a psychologist? Or is it time for us to try some treatment here and try some medication until time permits, or whatever consideration the patient might need to put in? And then it's so important to talk about, like, and you may not always find the right medicine the first time. So even your primary care might have to do a couple of trials before we've even referred you out, and to be a part of that conversation and not just come in and say, I'm depressed, do something about it, And it's definitely a conversation. It's a two-way street. And like Dr. Kieran mentioned too, we can give you the tools, but the work happens outside of that office. And that's so important. And then often for me, like if I have a patient that would like a referral, I'll recommend somebody that they can go see to start the search. Depending on your symptoms, we might try to find somebody who kind of specializes in a certain topic, like we mentioned ADHD and autism today, or a specific field. And sometimes your primary care may not have that referral. So you might have to go other routes, which, we're going to talk about here in a little bit too. But to know that, we'll start the conversation, we'll start some treatment options, we'll put you on some medication. And it might be a mixture of, with or without meds, with or without counseling, with or without a psychologist or a psychiatrist. But to keep an open mind to say that we'll find something that helps you feel better, and not be disheartened just because you came in and started the conversation with your PCP, with your primary care provider, and right off the bat, we didn't have a solution, or we said, hey, let's, do some homework and come back and reconvene, or do these questions and come back. And so, your treatment options in primary care will look a little bit like that too. There's a lot of work that happens in the background when we're asking you these questions. And as a patient, that can feel frustrating. But, I consider ourselves little detectives in healthcare. We have to do some of that background research so that we're not doing any harm to you. So we're taking your best interests at heart, because every patient doesn't present the same way. So when a patient comes in and says, I just feel tired all the time, for one patient, that diagnosis might be completely different than what it is for somebody else. And that's what's really important. You may not come in with the diagnosis, but, we'll do kind of some of that research to say, hey, these are the treatment options that are best for you, and kind of having faith in that process for us too. And then I know that Dr. Amin, as a psychiatrist, you write meds for our patients. And so we have a partnership between primary care and psych in doing so. So I'll let you kind of talk a little bit about meds there too.
Thank you, Asma. In my training, my professor used to always tell us this is like, you have to think about yourself as a CSI. You're a clinical symptom investigator. Your job is to investigate what symptoms they have. Because I think in all specialties, psychiatry is something that people treat mental health and psychiatry as a stepchild. So they put up a long time before they start seeking treatment, right? And I think in the world of Siri and Alexa, and with the smartphones, we have pretty much everything on the click, and we expect everything on the click. Now, people kind of suffer from anxiety and depression for years before they decide to even talk about it and seek treatment. And I think once they decide to seek treatment, I think the expectation becomes like, why am I not better? Right? So it takes time. And sometimes we have to think about where and when medication is necessary. Now, 50 years ago, it was a very different story. We didn't know anything about it. But now science has reached to the point that we know, researchers have found this over and over, that mental illness is a result of chemical imbalance in your body, in your brain. Depression and anxiety happens because there is a lack of serotonin in your brain. Kids are not able to pay attention and focus and they're all over the place because there is dopamine that's not working in the frontal lobe of the brain. There is a lot of more dopamine in patients with schizophrenia, and that's what makes them more psychotic. So we have this evidence that we know that this is exactly what's going on in the brain. And we are very fortunate to have medication that can alter or fix that chemical imbalance. So we don't treat every patient with medications. And I often give this example is like, if in diabetes, if your blood sugar level is supposed to be 160, if your blood sugar is 180 or 190, not your primary care doctor is going to put you on a medication, but they're going to recommend you that you need to do your diet, you need to exercise, and you need to take care of your sugar levels and watch for it. They may not put you on medication. But if your sugar level is 360 or 70, you also know that I need medication at this point. Psychiatry is also the same exact thing. If your depression and anxiety is mild and moderate, you may not need anything. You can change your lifestyle. You can have a stress-free life. You can do a lot of relaxation techniques. Oftentimes, moderate anxiety, depression can be treated with therapy. But if your symptoms are serious enough where it's interfering with your personal, professional, or relationship or social life, that's when we start the discussion of medication. Now, once we decide to do the medication, now we have to know that medication has risk and side effects. But oftentimes we think about the side effects and then we don't take it. So, like Tylenol, if you read about Tylenol, you'll have tons of, forget about Tylenol. If you read about water, drinking water can cause you intoxication, right? But we know how common it is. Now, we have years of data that we have collected and we know which medications are safe, what dose. So sometimes when it is necessary, we can and it is okay to take medication, but know the risk and benefit. Now, not one medication will fit everyone. It's like eyeglasses. It may be perfect for me, but if I give my glasses to you, you'll be like, are you crazy? Why are you wearing it? I can't see anything from it because it was not meant for. But in our culture, in our community, what we do, oh, you know what? I was on Falana and Falana was on Prozac and he got this. He was on ADHD medication and he looks like a zombie. It's not true. I mean, there may be something about it, but it's not everything about psychiatry. So I promise you, every day I see kids and patients, and they come back and they say that my life is different. They come into tears when they say that why I did not start the medicine before. We don't hear about those stories because still we don't like to talk about mental health. We don't like to talk about the benefit of what medication can do. So again, it's a spectrum. Not everybody needs medication, and then people who needs medication should be open to have a conversation. And that's what we want to do today is like hear about it, talk about it, have an open mind about it. If you don't try, you will not know whether it's working or not. And once we start, again, it's not a click. Sometimes this medications, this chemical imbalance takes weeks or months to start working. Sometimes side effects happens before the medication. So if you're on an SSRI for anxiety or depression, medicine works in your gut, and that's why you feel nausea, vomiting, headache, stomach ache for about a week or two. But the benefit of the medicine will happen after 6 weeks being on it. But we are a lot of impatient people that wants to have the benefit right away. Like I have a headache, I take Tylenol, my headache goes away. Why does it happen with the depression medicine? Because it's a two completely different illness. So I think we need to have a open mind about it and have a patience and have a constant discussion with your psychiatrist and primary care doctor about like, hey, I've tried this, now what? If one is not working, we always have two or three. So keep an open mind about it. Now, Kiran, tell us what happens when you treat patients.
Yeah. So I want to focus a little bit on ADHD because it is one of the most, overdiagnosed, especially in children, but also sometimes it's undetected. And, we find that adults are kind of struggling and really they've been struggling all along. So one of the things I wanted to focus on today is, you might find that you your child, or you know someone is struggling in school, and there's just this word thrown around, do they have ADHD? And the simplest answer to that is no, not necessarily. But one of the things to do when you might suspect that my child might be suffering from ADHD or a learning disability is to, again, going back to our primary care, go to the child's pediatrician or the primary care provider. And they have a good basic idea of what the symptoms are. So they'll sort of be able to gather more information about the symptoms. And if they really feel like we need to sort of refer you out, that's when, the person would then be referred to me. So what I would initially do is we don't just jump into ADHD testing. I, again, will do an initial evaluation. I'll ask a lot of background information. Does it run in the family? That's a big one. And then really, I want to look at behaviors at school, behaviors at home. The beauty of ADHD is that we don't only see it at school, right? We're going to start seeing it in multiple settings. So we want to try to get a lot of information before I put someone through testing. And it's really important that I am able to determine that testing is the right option for this person, right? So let's say that I do decide that I feel like testing will be beneficial. That's when I'll, help set up my patient or the family with testing, and then I'll walk them through sort of what happens. Part of testing will be not just administering it, but I also score everything, and then we do a session where I go over the entire report. I'll give recommendations, whether it's going back to your primary care or psychiatrist to explore medication options, or we're going to work on skills in therapy, or we're going to get you accommodations at school. So there's a lot of pieces of testing, and I'll oftentimes work with multiple professionals, especially schools, to really help get that structure in place. Another thing about ADHD is that I feel that sometimes it does overlap with mood disorders. So, someone might be struggling with anxiety or depression, and the symptoms will look very similar to ADHD, the biggest one being I can't focus. But if we talk about, not to put too much clinical language, but not being able to focus also happens with anxiety and also happens with depression, right? So we really want to do a thorough evaluation to determine if it is truly ADHD. And my goal is always to find the root cause, right? We're not just going to give you a diagnosis, get you the accommodations, because the likelihood of all of that working is pretty low if you don't actually have ADHD. So just a little bit about testing. I know that tends to be a little bit of a newer topic. And I'm happy to answer more questions if people have them about testing specifically. All right. So do we have more time for questions?
I think there's just one more thing that I wanted to briefly touch base on in terms of like, how does a patient know if their treatment's working? And then real quickly, someone also direct messaged, and I think Dr. Amin, this was something you wanted to talk about, was how to go about finding a good psychiatrist and finding a good fit. And so real quick, I just wanted to kind of talk about how do you know if the treatment plan that you've established is working. And so we do have some measurable like testing, as Dr. Kiran mentioned, in primary care. That might be those questionnaires that I mentioned at the beginning with like a generalized anxiety score, or a PHQ-9 as we refer to them. And that kind of just gives us an objective measure to see how you were feeling when you first came to us and how you're feeling now. And it gives us a measurable goal to say, so you're not just like, well, I feel like 20% better, which I can't really measure. What does that mean? Is this medicine working? Do I need to change the dose? Do we need to add something else? Do we need to do something different? And so it gives us kind of a measurable stake, like, so that I know where we're progressing. And then of course, your psychiatrist, your psychologist, your counselor has other measurable goals, or goals you may have set at the beginning of your therapy or your session with them. So we have some tools, and then we have some stuff that we've discussed and said, my goal is to be able to go to school without having a panic attack. And once you can accomplish that, then we can say, hey, that's something we can measure that you were successful with, And then similarly, I'm going to kind of piggyback on that diabetes example. When you have diabetes and you are on medication and we finally like, yes, your sugar is looking better, your blood sugars are normal, I'm not worried about you when I'm going to bed at night. You don't just say, okay, now that my sugar is normal, throw all my meds away, right? That's when the real work comes in, because you start to feel better. And then you start thinking, I no longer need this. This was just a crutch, as patients will often say. So you want to remember and kind of stick with that analogy that when you came in and you weren't feeling well, and we've done some legwork to kind of say, hey, this is what works for you, then you don't want to just abandon ship when you start to feel better and say, out the window this medication goes because I don't need it anymore. You want to kind of have that conversation with your provider. And if you're hesitant to continue your medication, talk to us. Again, we didn't force you into starting the medication. We're not going to force you into staying on something you don't feel comfortable with, but it's definitely a conversation to be had to know, are these measurable goals or not? The second thing, and I'll kind of segue this over to Dr. Amin, is finding the right provider, is like dating. So you want to find the person that you can match with. You might come into my office and say, oh, so-and-so liked Esma, so let me go see her. And then you come in and you're like, no way, this girl and I are just not clicking. And that's okay. It's nothing personal. I'm not going to look at you in Kane and not say Yalimala anymore. It's not personal at all. You have to find somebody who you can trust, who that you feel comfortable being yourself with, and kind of shedding some of that veil and coming out and being yourself around them. And if that's not the person when you walk in, that's perfectly fine, but have that conversation. Don't just ghost us. Just like it's not fun in the dating world, it's not fun in the professional world either. And so do your research when you're going in, but once you meet the person too, make sure if you don't click with them, that you have a conversation about that, so that we can continue to improve ourselves as well. And I'll kind of let Dr. Amin talk about a little bit more about finding the right provider and the right fit.
So as you mentioned, it's like a dating. So oftentimes I say that, hey, whenever you see a psychiatrist, don't think that you're going to lock in for the life. It's not like you only get one psychiatrist for life. Now, there is a lot of need for the psychiatrists. I think we did the study in 2016 where we found like how many child psychiatrists do we need based on the mental illness. And I think the number was about 32,000 psychiatrists was needed. And I think at the time when we looked at how many licensed board certified psychiatrists are available, it was only 8,000. So there is increased need, and oftentimes we hear about this complaint is like the wait time is about for 2 months or 3 months. I mean, so it's extensive, long wait time, but there is a lot of people who are available. So how to start finding a good psychiatrist? So number one is to start with your primary care doctor. A lot of the insurance will require you to have a primary care doctor refer a patients to a psychiatrist because that's considered as a specialty. Now, if you have a private insurance on the back of your insurance card, you will have a 800 number. Call that number and ask them who is in network for your insurance. That's another way. If you do not have insurance, you can go on a county website and find the mental health center in your catchment area. The really good tool that we use is called psychologisttoday.com. You can find psychiatrists, therapists, whatever. You can find it, what diagnosis you're looking for, what age group, what insurance they take, how many years of experience they have, what they look like, what they do. And I think that gives you a lot of insight into what kind of that person is. And then go and see that psychiatrist or therapist. And I think you have to be open minded about that. Is like there may be a case that you may like a psychiatrist at first sight and then hate for the rest of your treatment, or you may be the vice versa. So I think you need to give at least 2 to 3 visits to go and see. Now there are a lot of times people read the reviews of the psychiatrists and therapists. Reviews in psychiatry may not be accurate. The reason is good patients, because of the confidentiality, will not go and post reviews because then it has to disclose their identity. But angry patients, so if somebody comes to me and say that, hey, I need ADHD medication, and I don't think they need it. I mean, there's always people who are like, I need Adderall. No, you don't. Right? So they may get upset and angry and they may write a bad review. But it's not real testimony of what kind of doctor I am, right? So it always a good idea for you to go and see the person and then make a judgment. Now, oftentimes I get questions regarding, will my psychiatrist, will my therapist take my insurance? Will my treatment be covered by the insurance? I want to ask Kiran, what's your experience like, and give us some information about it.
Yeah, thank you. I'll be very brief. But again, the simplest answer is that yes, most insurance do cover mental health under either specialty care or behavioral health. My experience has been that it is covered under behavioral health more so than the specialty care. But if for any reason your insurance doesn't cover the mental health treatment, we've mentioned this several times, but there are agencies and community clinics that do either provide free of charge services or even a sliding scale, which is just a reduced fee based on your income to make treatment more affordable. And then if you do find yourself with no insurance at all, again, there are clinics who will provide either free treatment for a limited amount of sessions, or they may accept private pay, or they will work with you to set up a payment plan. So there are a lot of options. And then a little bit more for my college students and my kids. So college students, is usually a counseling center at your college, which is either included in your tuition actually, or there might be a small fee of $5 or $10 per session. So you can always reach out to them. And then for kids, there's always typically a psychologist, a school psychologist, or a social worker available as well. To kind of help you bridge that gap. And then they might refer you still back to someone in the outpatient setting like myself. But that's a really good way to really find someone to talk to immediately at your school. And then finally, we have access, so they can also help find a psychologist or a provider in your area and other resources if needed.
Thank you so much, Kiran. I hope, Jamaat, we were able to answer a lot of your questions. We do have about 10 to 15 minutes where we would like to take audience questions if you have. There are a few really nice questions. We will try to answer as many as we can. So I'll start with the first one, and then Asma and Kiran, please join me. So the first question I want to answer is like, and we often get this question is, my family member is in desperate need of mental health treatment, but they are not willing or would not even see a therapist or psychiatrist. What do we do? And I think this is a very good question, and this happens to pretty much a lot of the people. Now, it depends on how you're addressing it. Oftentimes, what we see or what we have experienced is a person comes and says that you have a problem and you need to come and see someone. So the person is already suffering from mental illness, is not at his best or her best. And then someone else comes and say that, hey, you need to go. So they already feeling low and down, and then subconsciously, even we have the best and best interest for the other person, we may not even realize, but it come across that way. That may not be your intention, but when you say that, hey, I am good, I am perfect, you are imperfect and you need treatment. And I think when we have that approach, that's one of the time that they don't want to do it. The other problem is the nature of psychiatry and the nature of mental illness is that depression, one of the criteria is it makes people think negative. It makes people helpless and hopeless. That is a part and that is a symptom of a depression. So when they're already feeling it, they're not going to feel like, hey, I'm optimistic, let's go and get treatment. They are going to feel like, what's the point? Nothing is working. I've tried anything. So that is the attitude they have. So I think in this condition, what we need to do when somebody of your loved one is not willing or want to go, I think the first step is to sit, make an eye contact, sit together and say, hey, what's going on with you? Hear them out where they're coming from. And then say, you know what you're going through seems really a lot. And I don't think I am capable of doing anything, and we want the best. Let's go and talk to someone who is known. I promise you, if you don't want to continue, if you don't want to do it, we will not do it. Let's go ahead and take first step. And I think if you come from that approach, a lot of the acceptance will come. So that's one. The second step is once person comes and say, hey, this person is diagnosed with bipolar or depression or ADHD or oppositional defiant disorder and now does not want to take treatment. Now it is up to the professional. So that's where I and Kiran will come into the place. And this is what we are trained into. So we work with that person over and over and over. Your job is to just bring them to the appointment. And I think once they come to the appointment, that's where we come into the place and we talk to them. Uh, Again, it's not 100% success, but a lot of the times we do see that they get better and they accept eventually the treatment. The biggest problem and concern is when there is a safety concern, right? So if somebody is having thoughts of hurting themselves, or somebody is having thoughts of hurting other people, or they're not taking care of themselves and putting themselves in a danger where they will be a risk to self or others, I think that's the time that you say, you know what, that good talk is not going to work. I need to reach out for help. So even if you have to call 911 and get them to the hospital, you have to do that. Now, if there is a immediate safety concerns, you can call 911 and they'll take you to the hospital. Other times when patients are more sick and refusing the treatment, there are multiple things that you can do. You can go to the family court and request a petition to seek mental health treatment for somebody who's refusing to do it. For minors, it's easier for the parents to say, hey, I give consent. Can you go ahead and start the treatment? So there are a lot of the things that are there. Bottom line, don't give up. If you are not able to do it, ask somebody else from the family or friends that person who's struggling, you can talk to that person and then reach out. You can always reach out to Access and say, hey, we have so and so person, they are not willing, can you guide us, tell us? You can talk to your primary care doctor and say, hey, this and this person is, they may be able to help. So if you see something, please reach out and do something about it. Asma, Kiran, guys, go for the next question.
That was an excellent explanation. And I just wanted to add, I think when there are Jamaati members who are not wanting to sort of start treatment, again, I think to echo what Dr. Amin is saying, that, just kind of emphasizing that we want to say that we're here. And whenever you're ready, right? One of the things I actually, again, comes up with some of my parents when I work with kids, it's like, the kid doesn't want to be in therapy, but I, as a parent, feel like they need to be. And my answer to them always is that, I don't want them to have a bad experience when it comes to therapy. I don't want this to be something that's forced on them, right? Again, of course, if it's a safety concern, we're going to be a little bit more forceful. But I want this to be something that's on their own and something that they're willing to do, because if it's something that they're motivated, that's when it's going to work best, right? But regardless of all of that, knowing that, there's help out there, and whenever you're ready, like, please reach out.
Thank you, guys. Another good question that I saw posted was where to get information if you don't have insurance, and where you might be able to get those resources. And so to just kind of address that question, we briefly touched on it. And I think Dr. Kiran had mentioned that you can call, if you have insurance, the number on the back of the card, but without insurance, as a Smileys, we're really fortunate to have access. And so if you call your access line locally, the local team can help you find resources in your area and your respective regions. Your primary care provider is also a good resource. I have a list that I'll provide to my patients, again, of psychiatrists that I've worked with that I might feel comfortable referring them to, or counselors or psychologists. But honestly, we're fortunate in our community that we have access to the Access Line and Social Welfare Board has liaisons that help us reach out to community members. So your best bet would be to kind of reach out to one of the volunteers through Access. And, you know, a lot of people think that you have to call Access only if you have like a big deal or if there's like a big case that you want to open, but really you can call to find out those resources as well. So that might be a good launching point. Is that correct, Dr. Amin? Anything else you guys want to add?
No, I think that's excellent. And you
Sorry,
can
and then
always...
also I think you mentioned through your employers and your school programs too. I forgot to reiterate that.
Right, right. So there are a lot of online resources also available. There are services that now with the pandemic has opened to the whole new chapter of like online psychiatrists and therapists. If you have a busy schedule, if you're not able to make time, you can always see somebody online. I think because of the time, we may have to wrap up. There is one question that a lot of Jamaati member has asked about the ADHD and adult ADHD. I think with any psychiatric, and I think somebody asked about the OCD, I'll say in general, like any psychiatric illness where you feel that the symptoms are serious enough where it's interfering with your functioning, your personal, professional, social, relationship-wise, if it is changing your thoughts, your behavior, your emotions to the point it's interfering, that's when you need to seek treatment. Now, that is the question that you, when you do the evaluation, you need to ask your psychiatrist very plain. And this is what I get every day is like, is there a way to treat this without medication? There are people who wants to do the medication. There are people who don't want to do the medication. So for anxiety and depression, we have some data available. So if we do the treatment with therapy, there is about 65% success rate. When we do the treatment with medication, that's about 65 to 66% success rate. When you do the combination of medication and therapy together, the success rate is about 92 to 93%. So that data is available. Now, ADHD may be a little different. ADHD, there's more medication than therapy. If it is just anxiety, we emphasize more on therapy. If it is OCD, more emphasis on symptoms reduction and response prevention. That's more therapy than the medication. Not medication will work a lot for the OCD and stuff. So that's where the therapy comes a lot. So I think that is a discussion you need to have with your psychiatrist, with your therapist and primary care doctor. But I think the first step and the goal of this webinar is to not be scared, not be worried about mental health treatment. It is not a monster who's gonna eat you away. It is something that will help you and take away and make the monster run away from your life. So with this, I think we may have to end here. Thank you so much, Jamaat, for participating. Asma and Kiran, any parting words, any last take-home message?
No, I just want to thank you guys again for joining us tonight. I think it's just really important to understand that we're all here to help in different respects in our individual capacities. And if you take nothing else away, then understand that mental health is a big topic, that you don't have to come in already knowing what you're seeking from us. Just trust a provider, go in, ask questions. And really the purpose that us as a team between a psychologist, a psychiatrist, and your primary care provider, we're here to help you live your best quality of life. And if you feel like your mental health is limiting that, then call us. That's what we're here for. And, you know, I think all three of us feel the same way, that this is what we do for work. It's an opportunity to serve people. And it's really, we're fortunate when you come and ask those questions. So don't hesitate, reach out. And when in doubt, ask somebody, because we're probably here to help you anyways. So thank you guys.
Absolutely. I also want to thank everyone for joining, and know that we're on your side and we're a team and we're going to get through it together. And that's why we're here. So thank you so much.
Thank you, Jamaat. Ya Ali Madad.
Ya Ali Madad.